KEFSA, which is the Pharmacy Students Association of Kenya. Tonight, we have Faith Muigai, who is the Regional Director at SafeCare program with PharmAccess Foundation. So we can welcome her. Faith, you can go ahead and say hi and give a brief introduction.
Thank you. Thank you so much. And thank you for the invitation for being here. My name is Faith Muigai, Regional Director for the SafeCare program with an organization called PharmAccess Foundation. I've been in the healthcare industry for over 20 years in different capacities. And in those capacities, I've been growing and learning, trying to better myself every day. So my clinical background is nursing. I then specialized as a neuroscience nurse. I then went into program management, research, and this was all done in the United States. So my lens has been kind of broadened, having been able to be exposed to different cultures, different worlds. Growing up, I was born in Italy. I grew up in Nigeria, Zambia, then came back home, then went to the States at the age of 17. Lived in the US for about 17 years, and I feel that's where I've gathered a lot of my experience, and then decided to move back home in 2012 to say, I've seen healthcare systems that are kind of working. How do we now transplant those pearls to ensure that we are driving a system that works here? So in my current capacity, I run a program that actually assesses hospitals for quality in care, which means we are able to do risk assessments to tell you if you're ready or not to deliver services. And we give you a report card, so to speak, and then give you plans for you to execute to understand where you're going and so on in terms of quality improvement. So that's where I am. Prior to that in Kenya, I was running a hospital. We started it from ground scratch, Jacaranda Maternity. We started out with one hospital, graduated to 2. And in that tenure, it was about 7 years, I was able to, with a wonderful team, lead the hospital to becoming a SafeCare, the program I'm running now, star 5, so like a 5-star hotel that was saying that even in informal sector, women and children deserve the same care that you would in a developed country. So we proved that. Very proud of that. So in my role, what I'm trying to do is preach about it can happen. We need to have the drive to make it happen. We need to advocate for the right resources, policies, and an enabling environment to make it happen. But for me, as you've seen with COVID-19 right now, health is at the epicenter of everything we're talking about. It has actually had a huge, you're seeing the impact it has on an economy in terms of if you are not healthy, if we cannot maintain a healthy society, your economy falls. And right now you can see we're in a sort of tight balance. Do we open, do we close, do we this, do we that? And we're making a lot of decisions because it's lessons learned, but we're seeing how health is the epicenter of all industries. And without a strengthened healthcare system, economies actually fail.
Yeah. Okay. I think that's very amazing. Your background is quite impressive. I'd like to take it back back to the beginning. Maybe you can tell us about how your, not necessarily family setup, but how it was growing up. Did you face challenges like maybe at home, financial challenges? Yeah.
So let me start by I grew up in a very privileged background. Yeah. My father was a diplomat, so we traveled quite a bit. He was in diplomatic service. So in terms of being able to eat and not worry about food, being able to go to good schools and so on, that wasn't an issue. And he always strived to make sure that he could provide for us. He also made sure we're not spoiled. So even my father being somebody who is homegrown, Kakamega boys, Makerere, and so on, airlift generation, he's 87 on Tuesday. His experiences made sure that we were disciplined and we had values and so on and so forth. So like I said, a very privileged background, you know, I can't say that I was denied too much, but once again came from a family of values. By the time I was about 16, I started making decisions, and I was a very headstrong person. And I think it's because of having headstrong parents who are very decisive, very, very committed, and very, very driven, and value the community. So at 16 years old, I think I was in Form 3 at the time, and I went to my dad and said, I'm not going back to school. And so he looked at me like, huh? And then, my mother says, okay, you're mad. Yeah. So I said, you know what, I'm in Form 3, but there are things I need to do with my life. So I actually want to take my O level. So I was in a KCPE school. I was in Loreto Convent, Muigai. And I said, okay, I want to take my O levels a year earlier. So I went to Brabant with the November exam and took my O levels. My father says, if you pass, we'll think about you going elsewhere. My mother said, if you fail, you're going to work on the farm.
Yeah.
So I homeschooled myself for a period of time, and in November I took the exam and I passed. And so as headstrong as I was, the tables turned and they actually committed to what they said, that I could go. And that was my journey to actually going to access colleges in the US, because my parents also in the 60s were airlift. So they felt exposure, being exposed to different cultures and people was critical to holistically building themselves. So they actually wanted to give me that opportunity to go and widen my lens. And that was I am the last born. I will say I'm not spoiled, but I am the last born of 6 individuals. Between me and the person that I follow, there's a 7-year gap. So you can see I was the retirement baby. So even with that privilege, there were things I saw, because we was a highlight in the beginning. But then when my parents started retiring, things became a little bit more difficult. When you have parents who are asset rich, but not cash, but cash poor. Have you ever heard of that expression? So you have a lot of property and you invested, but in the bank account there's no liquid. So the life that my siblings used to live and the one I saw, I started seeing challenges and started seeing them struggle. Sometimes school fees was paid, sometimes not, and you're on time and all of that, and you're pulled out of class and all of that. So for me, I feel I've had a very interesting upbringing in terms of I saw both ends of the stick. Whereas you can be very privileged, but then on the other hand, you can be actually having challenges just like everybody else, and life hits you when you least expect it.
Do you think the exposure was key for you? And how can others without such a privileged background also gain the same exposure?
I think it has to do with who you link yourself to, who you associate with, and you're actively looking. A lot of people think that things are going to drop on their shoulder, and they're not proactive in looking at different avenues or methodologies to growing themselves. We have a lot of significant people in this country, both Kenyan and non-Kenyan. Yeah? So how are you proactively assessing what you need as a person, where you're trying to grow, and start building links to individuals who can actually help guide you and give you advice, and also give you honest feedback in terms of you're going in the right direction, you're not going in the right direction. So you have to actively want to seek, and not everybody gets the opportunity to go outside. It's a privilege, but you can actually internally from a national level seek. When you look at WHO, you have people like Rudy Eggers. He's British. When you look at some other organizations, so you think other exposed people come here. So my question is, are you seeking them out? And then are you asking the right questions? And then are you open to learning?
Okay, there's this quote I once read, well, not really a quote, but they were talking about how when you're seeking for a mentor, you also have to bring value to the table. And I felt that was also a bit hard because most of us actually, we're all university students. The most we probably have to give is, the knowledge that we have in school, but what more can we give to mentors that can put us in a better place to be accepted, to be mentored?
So you have to bring value. The value you bring to a mentor is your commitment to learn. Don't waste my time if you don't want to learn, right? and don't just want to put on your resume that I'm associated with faith, and yet you're not putting in your effort to actually build yourself and learn. So there's some sort of self motivation where you're gathering feedback, you're getting different opinions, and then when you come to the mentor, it's exploring or discussing, right? Mentor is not going to throw everything on you. It's a two-way street. Yeah. Mm-hmm. So it's like you have to do your part, and then they'll be motivated to motivate you, but you have to show that motivation. So you have to proactively seek knowledge, seek questions that you want answers, have possible solutions, and then come and sit down with your mentor. You have to want to actually walk in their walk. So take the time to say, you know what, you're going to be having a meeting with the Ministry of Health. Please can I come in and see how you handle this? How do you run a meeting? Okay, how do you constructively make conversations that make sense at the table so that people can hear you? So you have to be clear on what you want from that mentor. Yeah, don't leave it to the mentor to bring to you. You have to be clear. What do you want? If this is a CEO, I want to be a CEO. So I want to learn how to be a CEO. So I want to strategically place myself. And so I look at opportunities that this person has and say, can I plug in and play here and here? Because I want to learn. And then formulate questions. Learn from others and formulate questions, and then bring them and hash them out. So once again, don't wait for somebody to spoon feed you. Yeah. In fact, it's the opposite around. You have to be. You have to show that you're taking initiative to grow yourself, and using them as a vehicle, as an added vehicle, but not the only vehicle.
Wow, I think that's quite insightful. Now back to how your education how your education progressed. So you said from O levels you now went into States to go do nursing. So did you know from the get-go you want to do nursing? How were you on that? Yeah.
It kind of evolved, and it evolved from, this is where I say I went into an environment where I was broken down, and then broken down to build myself up. So having been a privileged girl here, when I went to the US, I made some decisions, some wrong decisions that actually, it ended up costing me, my parents saying, you're in a very expensive state. We sent you to one that was very, very affordable. You've moved to a state where the school fees is 3 times. Yeah. So since you think that you're machino, okay, we'll send you that that fee but the other $4,000, you're on your own. Yeah. So at 17, I had to seek employment, and I sought employment as a certified nursing assistant, right? So an allied health specialist. And that was in nursing homes. And in nursing homes, when you guys here 17 to 21, you're not cleaning anybody, you're not wiping anybody, you're not turning and repositioning, you're not feeding anybody. So it broke me down in terms of I was taking care of elderly as I would my child. And you are seeing things that you never see here, I am a nurse, so I can say, like I said, you're wiping them when they're going to the toilet. When they vomit, you're wiping it. So there was shock on me because I come from a different world. Now what am I doing, right? Now, originally I was going to go into medicine. That was the plan, because in my day, you're either a finance, lawyer, doctor. Those are the only things that were recognized. Everything else was whatever. So even me, I went to the States saying I have to have this pillar, whatever. But when I went into the nursing homes and I was working with nurses, I was being mentored and I watched them. They were dynamic. We were changing lives. We were changing families. We were talking. We were healing. We were bonding. We were facilitating healing. I saw another side of I always knew I was going to go into healthcare. I just didn't know where. But I saw another side of healthcare that really, really provoked what I wanted to do. And then remember, I was also taking care of half my bills, like the apartment I was living in, the car I was driving, all this is 17, 18, by the way. And so I had to also maintain myself as an individual, because my parents couldn't maintain my lifestyle because I changed switch to whatever. So I decided, okay, I want to become a diploma nurse. Let me start out with nursing because I can start out with nursing, get a good job, and then pay my way through med school. So I went and became an associate degree, diploma degree nurse, right? And to be really honest, my technical abilities were now being built. But as I was going into it and as I was training, I loved it. It was just, I was at the bedside. I was connecting. I was transforming. You had families telling you, if it's not for you, I don't know what dad would have done. If it wasn't for you, if it wasn't for you, you wouldn't have woken up to go to the toilet. And that was a game changer. So I started realizing the power I had in actually facilitating healing and helping communities and families grow. And there was a different element of the table, and I loved it. So I said, you know what? Okay, I'm a nurse. Now I'm never going to stop. I always want to be the best that I can be. So I then went in to do my bachelor's degree. And that time I was actually working full time, going to school full time, spitting out babies at the same time, and all of that. You know what I mean? So you're doing all of that at the same time. You're trying to grow, you're trying to lead, you're trying to work-life balance is crazy, but you didn't have an option. After that, I moved to Johns Hopkins Hospital in Maryland. I specialized now in my area. After I specialized, I now went into research and program management. So now I left the floor as a specialist, but then started growing programs in different hospitals and so on and so forth, moved to Sinai, then now became a director and all of growth. In that time, I'm still doing my master's degree. I'm still working full time. I'm spitting out the second baby. So I'm still a mother, yeah, and a wife. So you're wearing very, very many hats at the same time, learning because I like to learn, but growing in different capacities. And as I was growing, when I went into administration, I tagged myself with an MBA, So I didn't tag myself with a doctor because there was another skill set I needed to learn. So when you're looking for mentors, what skill set do you want from them? Me, I wanted to be able to run hospitals. I wanted to be a CEO. Yeah. I didn't want to remain as a chief nurse officer, and I wanted to expand. I wanted to be able to impact any industry. And in that, it was leadership, development, and growth. How do I run a budget? How do I manage people and performance manage them? Those are things I didn't learn in nursing school. So I needed to tag myself with people who had capabilities or roles that would influence where I wanted to go. Like I said, one of my greatest mentors, Jessica Cooper, MBA, but she ran a neuroscience department. And in running a neuroscience department, let me tell you, she could break down how spinal surgery is done. And she was not a doctor. Yeah? So when you're aligning yourself, what is your pathway to growth? Be very, very clear. And I decided that my pathway was leaving bedside, but influencing bedside, because now I want to make sure hospitals are running well and they are safe. And then I want to drive policy. And that's a key thing that I did when I came back home, because I'm sitting at the table at the Ministry of Health. I sit on the board of the Kenya Healthcare Federation as a board director. I was sitting on the board of Humani Hospital. So you're seeing public-private. I needed to understand my ecosystem. Yeah, and it's not in one lens. So that was my progression to in terms of professional development. But me knowing that if I came home, I did not want to work on the floor, because I'm gonna be real. The current state, I would not be able to function. I think how I am. You're going to take me to a hospital that is under-equipped, poor staff. I can't. But for me, I said, let me demonstrate that if you put the right things in place, you can run a decent hospital. And for me, that was my goal. Demonstrate and then push policy to put things in place so that our healthcare system is strengthened. And that has been my journey ever since. That's what I'm advocating for, because I feel that the experience that I have in Aga Khan, Mama Mboga should have it the same way. No compromise. There's no compromise. I don't care what socioeconomic status you are, everybody deserves the same type of care. The look and feel might be different, but in terms of safety and outcomes, it should be the same.
You had mentioned that your mentor, Jessica Cooper, like she's also the one that helped you progress your career. So for you, it was, you got the learning aspect as well as the practical aspect of it. So do we have such platforms in the nation where students can get useful information and also learn in the process? Something like experiential learning opportunities.
That I think is where we lack, particularly when I'll give you an example. You know Jeremy Awori, CEO of ABSA.
Oh.
If I was a young person in healthcare, yeah, this is somebody who has, I think he has a pharmacy background, doesn't he? David, doesn't he? I think so. But he's running a bank. So it's people like those who have diversified and might understand where you're coming from. But why do they have to understand where you're coming from? A CEO is a CEO. I would even tag myself with James Mwangi from Equity. Successful. Yeah. You see, successful. So, as healthcare providers, we tend to limit ourselves and think we're just technical experts. But in order to grow, go to other industries and learn. Look, the CS of education is a urologist, Magoha. Yeah? He didn't his career knowing he was going to be a CS of education, but he's doing it effectively, isn't it? And he's a doctor, you see? So these are some of the things in terms of look broadly, look beyond your industry, and then don't only look at Ministry of Health or Ministry of something, go beyond private sector corporations. If Bob called that, I would say, you guys, have him be a mentor because he's running top Forbes like organizations, and that should be the vision, that the sky is the limit, and just don't lock yourself in terms of I'll be in a state or I'll be in a Ministry of Health. Let me tell you, in my profession, I can work anywhere. It can be an advocacy, whatever, women's rights. It can be in industry. It can be in technology. Because in terms of even when I was on the floor 10, 15 years ago, informatics was a key. You can apply yourself in every industry. We say do not self-limit, and that's where we go wrong. As medical experts, you think this is where I am. I say broaden it, because in tech, you people, telemedicine, all of this, that's the next frontier. Why are you sitting at the table? When we look at infrastructure and all of that, why occupational health and safety standards, why aren't you at the table? Agriculture, nutrition, sanitation, why aren't you at the table? And in both public and private sector. So you can be working for 1 acre fund, or you can be working for the Ministry of Agriculture. It doesn't matter. It's about access, decreasing barriers and so on. And it's across the board. Marketing, I talk about COVID now, marketing and communications and PR. Who should be actually sending messages or working with people to have the right messaging to impact the community? Isn't it us? But that doesn't mean that we have to be sitting in the Ministry of Health. I can be sitting in a private scanner or something like that.
Sorry. I also wanted to ask.
Jeremy is a pharmacist. Yeah. CEO, ABSA, Barclays Bank.
Yeah.
Why not?
And even went through Standard Chartered. I've just seen in his LinkedIn profile.
There you go. Yeah. So you have to be bold enough to say, I want to lead. And leadership does not mean that you're leading in your own industry. Leadership means taking the tenets of your industry and applying them into other settings, right? And applying them into other settings, but also agreeing that you might not know everything and having the ability to learn from the other industries. So continuous learning is key. And do not be scared. And do not be scared to arm yourself with people around you who are actually more smarter than you. We live in top-down environments where people don't want other people to shine. Actually, for me as a leader, I'm a ring leader. I get people in my circle together, and I use the different talents to be able to transform, make change, and whatever, not by myself. And I don't take credit by myself. It is about building a functional team that can game change. So every job I go, I say I'm building my dream team.
I think that's really it's really insightful to be told that we don't have to only focus on, the technical aspect. There's so much more. There's marketing. There's I also wanted to give the example of Tamasi Korir, she's a medical journalist, which is
Yep.
yeah.
Yep.
Those are so beautiful. I also wanted to I also wanted to ask in terms of how the healthcare service in America compared to Kenya, and what specifically you wanted to come and implement back home here in Kenya, and also bring out the aspect of how you've grown up in different countries. So why come back to Kenya? Is our health that bad compared to the rest? Yeah.
I came home. Yeah. So why come back to Kenya? I came home. I'm not trying to live somebody else's life. I'm trying to grow myself, learn, but then I want to positively impact my people. Yeah. Maternal mortality rates are high. This is high. This is high. It's showing you that our systems are not working. And sometimes you need to bring the talent that has gone out back so that they can actually influence and help drive learning locally. So for me, it's up to us from the diaspora to come back home and just show that other systems are working. How do we now prioritize in strengthening our system? So me, I came back home, and that was always a priority. I was not forced to come home. I always wanted to come home. And I have parents who are here that I want to take care of. My father is 87. My mom is 84. It's, so it's about family, and it's about commitment and being patriotic. I love my country. I love my country. So having been exposed was a learning. Like I said, if you look at my parents, the airlift community, all of them went, Wakina Kibaki, Bagub, all of these leaders, but they came back. And then when they came back, they were put in very, very critical positions. But they were put in critical positions because they had gotten exposed, they had learned, they have gotten higher degrees, all of those things. So to me, it's the same thing. I'm not saying that the education there is better than, but the exposure to different ways to do things gave me an opportunity to come and say, can I be the change I want to see? I don't want to go to hospitals where women are being beaten. I don't want to go to hospitals where there's one oxygen tank to 5 babies and you have to play God. I don't want to go to hospitals where the supply chain, the quality, you're feeding drugs that are sugar pills and people are not getting better. I don't want to. So for me, I wanted to transform the way healthcare is given with the primary goal of impacting our people and making sure our people get the best that they can and what they need. Now, it doesn't happen overnight. Yeah. It happens by being bold and being able to say, I agree with this, I don't agree with this. And navigating yourself through different systems to be a positive influence. And sometimes it's with a loud voice, and sometimes it's actually subtly. And you have to understand when to use your loud voice, and then you have to understand when to be subtle.
Regarding what you said about coming back to Kenya, I think this is a fact. Most people here can agree. There's this notion to always go abroad because actually the amount of brain drain in Kenya is quite high. But you see, if you look at the opportunities in Kenya, probably the degree I have studied here in Kenya, what I will get paid for, at the end of the day, it's also about making an income. What you'll be paid for here in Kenya is not the same as what you'll be paid for abroad. And that's what most youth actually, they're convincing each other abroad is the only way to go. So how would you motivate or convince people to just stay here in Kenya despite, because I feel like it takes a lot to stay here in Kenya, to be honest.
I can't answer that one, and once again, different industries pay different, remunerate or recognize their professionals differently. Private sector probably has a better package than whatever, but then when you go to a public sector, you have a better retirement plan and so on. So there's a tough balance. You work in certain situations and then wait for your retirement plan, or do you get your money now? And I don't know, but I do know I do know when I graduated with associate degree in the US, I was able to buy a Mercedes-Benz and have a house and buy a house. That's not the case here. Yeah, that's not the case here. So even when I chose to come back, it was in a timely way that I can actually get a position where I don't compromise my lifestyle. So I feel that as health professionals, we have a fight to actually demonstrate our value and value for money. And as clinicians, we usually articulate ourselves based on technical aptitudes. I say change that theory, change that narrative, and show what your value is for money. If I have so many nurses on the floor, I can save so many lives, which means we are preventing so many preventable complications, which means I'm saving the hospital because I'm not now wanting to imprison people in the hospital because they can't pay a bill. And a bill because they got a preventable complication because somebody decided not to wash their hands and they got hospital infection. You see what I'm saying? And then show it in figures. You see, we don't show it in figures. So when we're talking to people who are the key to unlocking money to invest in human resource and unlocking money in investing into our health system and our healthcare organizations, we're not saying the right thing. So every time, I'm hard on us on that because every time somebody says health, we want to talk about caring, empathy, fine, okay, we do that. Show me value for money, change the narrative. If I'm talking to a finance guy, it's toe to toe. If you invest this is what you'll save. If you get this, you have more referrals. Those referrals bring add revenue to the bottom line, and then we are able to plug and play and invest in our people, our infrastructure, our supplies, change the narrative.
Comparing in the Kenyan context and in the States, in terms of getting to make an impact, how would you rate these two?
If I'm comparing the US to here, how would I compare what?
Getting to make an impact, because in Kenya systems are a bit slower.
What's your definition of impact?
To be memorable. Yeah, to be memorable.
In what way? So, you see, me, impact is saving lives.
Yeah.
Impact is me making sure people don't get diseases they're not supposed to get. Impact is me ensuring that people are taking on health promotion behaviors and trying to lead healthy lives, but whatever. I don't want to be remembered. It's not about me being remembered. It's about how many lives am I changing for the better. So for me, that's how I view impact. You know, I think if you talk to anyone who has been to a hospital or has accessed healthcare or has talked to healthcare, they have been touched in one way or the other. Yeah, but being touched is well and good, and that's one person's experience. But if I look at a country, I want to see that my maternal mortality rates decreased based on interventions that I put in place, or based on interventions that with me working with the government or private sector, we designed, we put in place, we piloted, it worked, we scaled it up, it worked, and now we have actually decreased mortality rates, decreased neonatal mortality rates, and so on. So that's what I see as impact.
So based on that, what would you consider in terms of ability of someone to contribute to the society, looking at it from the gaps that are existing in Kenya, and the other aspect in terms of the US being a developed country, being you've experienced both aspects?
So I try not to compare myself because there's never apples for apples, but we have seen health systems that kind of work. Because even if you go to the US right now, people will say it's not working, isn't it? But for me, I would say it's better than what we have right now. So there's been some sort of investment. So I think one of the things we need to do is our set environment and our context is very, very different, yeah, and yet the same. You know, Black American women are dying just as much as the maternal mortality rate is here. So there's nothing better there than here, right? And yet they have very sophisticated systems. So something is, you know, amiss. So for me, I think is concentrate in our set context environment. Plus, sort of get lessons learned from areas that are work, but know that everything that is happening there will not happen here. I say that because when I look at dashboards in the US and stuff, they're looking at pressure outputs, they're looking at CORTI, UTI, VAP, they're looking at falls. Here, we haven't even started looking at falls. We're still at maternal mortality. You see, so even the indicators we're looking at, because of our context, more women are dying here. That's the focus on, even before you say elderly falls. Why not elderly falls? Because elderly are not in the hospital. They fall at home. Whereas elderly in the US go to the hospital, then they fall there because they are trying to go to the toilet. You see how we have to build solutions that are locally centric and borrow from the Western world. But I think we're smart enough. We have people. Do you know how many PhDs we have in this country and all of that? You know, operational excellence, operational research, implementation science. We need to use academia to learn here in Kenya what works, what doesn't work, and then advocate at a policy level to say, we have tested, we have researched, these are the outcomes. Now we need Treasury to actually give us money and funding to take it to 1 or 3 counties, like the UHC pilot, you know, let's test it out, learn, then we scale it. So I think there's a lot of things. I don't like comparing myself apples to apples. Even the SafeCare program that I run, yeah, there are localized custom healthcare standards that tie to international. But the solution might look and feel different because in Mandera, it's not going to look like Hopkins. Let's be serious.
I'd also like to bring up this question in terms of healthcare service delivery. What is being done to increase healthcare delivery towards the disabled people in Kenya? Because they are often the minority and often forgotten. So what's being done in the health sector to increase them accessing the healthcare services?
I think what we're seeing on a national level is policies are being put in place to address their needs. Yeah? Now you're seeing that, you know, when the MOH is actually coming to sign up a hospital, are you disability compliant? Are you able to whatever? Do you have an interpreter and all of that? So I think policies are now being looked at to provide enabling environments for us to actually to cater to effectively our individuals with disability, blind, you know, wheelchair access, and so on, deaf, dumb, and all of that. It will take a while, but you're seeing also a lot of advocacy groups also doing a lot to bridge the knowledge gap, so that as we're thinking about enabling policies, some of their rights and things that we should be considering are being put in place so they can be cascaded down on a facility level. I know when I was running a hospital, yes, I had to have a wheelchair accessible, whatever. I had to demonstrate that, you know, I was languages and all that. I had to demonstrate. So there's a lot of things I demonstrate to comply, to be able to open a hospital and say that I'm meeting needs of people who have disabilities.
Okay, I'm glad that the policy is being put in place and hospitals comply. The last question would be, how are you able to maintain a work-life balancing as is your job quite demanding that at times it takes you away from family? Are you able to make it maybe pre-corona times? Are you able to make it for parent-teacher meetings? Also as well as social life with your friends? Yeah.
So work is always demanding. Demanding because I'm a perfectionist and I like things being done in a certain way. I always say, you know, strive to accomplish your dreams to ensure self-worth and self-satisfaction. So I strive for perfection, but I learn from imperfection. It's a tight balance. I'm a mother of 2. I full-time. Before Corona, I was traveling almost every other week. I was all over the place. But sometimes, you know, when I look at the output and I see my daughter being accepted to ALA and I see my son having straight A's, it means there's something that I'm doing right, right?
Yeah.
And that the foundation period was the most was the one, you know, when you set that foundation, you fly. So I set a very big, and let me tell you, when I was in the US, remember we don't have maids. Yeah?
Yeah.
So remember when I'm telling you I'm being a director, I'm working full time, I'm splitting up. You don't have maids, so you're doing laundry, you're washing the dishes, you're making breakfast, you're making lunch. Your kids are 3-4 years old. The most demanding time, but that era forced me to be there for them, so that now that they're in the teenage phase, they are so independent. Yeah, and actually allow me or understand. In fact, right now, they see what I am doing in terms of work. Now they understand. Because when I used to go to the office and back, they didn't understand. So even COVID has brought in a good thing so that your children actually, have you ever seen children who say, what do your parents do? I don't know.
Yeah.
You know, that's the era now. I don't know. I guess he works in a major health where they don't know. You know, so COVID has allowed for our children to actually understand and see what we do. And I work hard. I work very hard, but I also try and make time to balance it out, socialize. Sometimes go manicure, pedicure, this, that,
Yeah.
and the other. You know, so you have to actually, and I'm not good at it. Let me say that, but I'm recognizing when we talk about psychosocial aid and all of that, you have to start with your self-care. And that's one thing that is you know, and we play different roles. You know, as women trying to go high up the corporate ladder, you're going toe to toe. And traditionally, women were the underdog, and now we're trying to go toe to toe. And I say, you know what? I'm not trying to be a man. I'm trying to be an effective woman in my role, and I bring something else to the table, and it's very different. So, you know, I'm not trying to compete with no, you know, I give birth, I this, I that. There's certain things I do that they can't do. So it's not a competition. I just need to show the value that I bring from my perspective as a professional and gender, where men also bring their perspective and whatever and gender, you know, and that is complementary, I feel. So work-life balance, I might be not very good at it, but I try.
Bottom line is trying. I think you brought out the aspect of self-care. So,
Yeah.
like as we were discussing earlier, what would you say are some practices that you try to implement to take care of your mental health? Because you come first before your husband, before your kids. So how are you able to take care of yourself first? Yeah.
Exercise, eat well, try and sleep, hang out with the right company, try meditation. I like to cook. I like to dance. You know, so I mean, just be real. And you know, I like to shop. You know, so yeah, the typical woman, right? So you know, just try to engage in. I don't read books very much, but I like to talk and I like to engage in with intellectual people. Learn from experiences and so on. So understand your story. You know, people are telling me write a journal. I can't write a journal. You know, read the book. I do the first 24 pages, and then if I didn't get it, I put it aside. But I like to watch documentaries. I like to watch things around history. Like I said, I like to engage with intellectual people, people who have been there and done that, and to understand how they did that and all of that. So the way I do things might not be the way that you do things, but getting rest is very, very key. And in times like this, where there's high anxiety and so on and so forth, it's hard. So exercise helps you. And then, you know, meditate. And when I say meditate, it's just listening to just calming music, just calming the ocean, whatever, before you sleep and whatever, you know, and then bring out your spiritual self, pray, you know, and I say that in the most honest way, but don't forget the spiritual side of things, because that also gives you strength, and me strength. And uplifts me knowing that there's somebody there who's looking out for me, and I look for guidance as well in them.
Wow. I like the way you brought out that you should have like different activities, if it's exercising, dancing, like whatever will fit the situation that will help you. So I'd like to leave it out to the audience. If there's anyone who has a question, feel free to leave it in the chat box, or as well, you can also unmute your microphone and ask any question you may have regarding anything we've talked about or anything you may feel relevant to this conversation.
There's a raised hand. Lillian, you can speak up.
Okay, thank you, David. Thank you, Stacy. So thank you so much, Faith, for those inspiring words. I'm a big fan and I'm inspired by your work in patient safety. So I have a few questions. The first one is, as you progress in your career, as you've said, you went into managerial and project management courses. Is it important to still keep in touch with your roots in nursing? So and how do you go about it? So as you progress towards the managerial bit of it, is it important also to keep in touch with nursing and just your background, your first degree? Is it important? And if yes, how do you go about it? And then the other question is about office politics and just climbing the corporate ladder. So how do you go about it so that you are very objective and to the point, and also at the same time you are not maybe misused or misused, or someone takes advantage of your ambition just to, and they don't give you that space to progress. And then, yeah, I think that's it from now. Thank you so much. And happy birthday to your dad. 87th birthday to your dad. Thank you.
Thank you. I think it's very, very important to keep to your roots. You know, I always say, first I'm a nurse, all accolades come later, yeah? CEO, director, and all of that. I am very proud of my profession and what it has done in various capacities. This is the year of the nurse and the midwife, and right now we're seeing frontline soldiers, which I used to be a frontline soldier, but in the different roles that I played, they were all in healthcare. And when you look at the healthcare statistics, nurses are the most. So in driving healthcare systems, in driving healthcare organizations, our numbers supersede. And for me, it has been trying to get the message about what we do and how we do. At the policy level, as an entrepreneur, as an academic, Florence Nightingale, she was a statistician and researcher. Yeah, she was trialing out things during the Crimean War. Ventilation, hand washing, turning and repositioning, all the things we're talking about now, social distancing, yeah, so that cholera doesn't spread and all of that. That was research, operational research, trial error. She wrote it down. She was seeing people get better. She wrote it down, and so for me, I feel that it is that I learned how to deal with people, nurture people, rally people based on what I did as an individual and in my profession. So I stand first as a nurse, everything comes later, and I keep in touch with various. So try to mentor young nurses. There are pathways to leading and excelling, different pathways, and you don't have to self-limit yourself. Being part of national and global organizations so that you're in tune with what is going on with the now. Interacting with leadership at the ministry level, but even in private sector, not just nationally, globally. So sitting at the tables or having conversations and making sure, challenging other professions to look at me and tell me, what should we be doing to drive nursing to whatever, you know. So I've been shaking the hand of Tedros. I'm saying, oh, nursing. Dr. Kamarogo, oh, nursing. So I'm also looking at other professions to actually give me insights on who we are. What. So it's not just looking in, but also having people from the outside look in to guide where I want to go and how I want to drive our nursing practice or our nursing profession. Because I actually, so like I said in the beginning, first a nurse, always a nurse, and then thereafter all these accolades. But I never forget what I used to do there, and it impacts a lot of the decisions I make today. How do I work? Office politics, blah, blah, blah. I think I say, know your value, okay? Know your value, understand your role, understand your contribution within the organization, and be able to articulate it in a way that is cross-cutting and that other people from other professions can understand. We as technical people use our own rhetoric, right? And might be very, very shallow in how we present what we're trying to do, advocate for, build strategies, and so on. So broaden the lens, know your value, and then articulate it in a way that is cross-cutting so that you're getting buy-in in different ways. I might have to say things the way a lawyer says things a little bit so he can understand what I'm saying. I might have to talk about revenues, margins, and all that so that my finance person understands what I'm talking about. I might have to talk about KPIs, but sort of dummy down, not dummy down, but upskill the way I'm describing those KPIs so my CEO sees them as valuable. When before you be talking about we need to reduce infection rate, tell them why and how does that hit the bottom line. So you need to know your value, but you need to know how to articulate to the audience you're projecting to, and that is very key. And being a woman, be a woman, and it's okay. You don't have to be subservient, but you have to be articulate and straight to the point. And it's about value and having people take you seriously. So plan your conversations, prepare your conversations, prepare that PowerPoint presentation so that it's hitting what you're trying to say. So all I'm saying is be prepared and have a focus on continuous learning and be okay with that.
Okay, thank you so much.
And when you talk about women in the workplace, build each other up because we tend to eat our young. So as we're trying to build leadership and having more women in roles of leadership, grab somebody's arm and take them with you. Don't forget that because you're building the future.
Those are some very insightful advice. Is there anyone else who has a question? In the meantime, maybe you can the audience, you can just unmute your microphone and just briefly introduce yourself so that even us, we can say that we have left knowing someone else. So if you can just say your name and maybe what university you are in, what year, what course, yeah, that would be great. You can start with Flora. Oh, Flora actually has a question, sorry.
Good evening, ladies.
Good evening.
Good evening.
Sorry, I joined in a bit late, but I'm thankful that I've had a bit of the discussion that have been ongoing. I have two questions. I'm a nurse and I currently work in a school, though we are closed down because of COVID. Now, I just have two questions that are not really related to nursing, but just on management issues. So if you happen to get passed over for an internal promotion, do you stick around or you plan an exit strategy? Number one. Two, how do you handle a boss who's insecure with you? How do you go about it? Thanks.
Okay. I think for me, the biggest thing is I've been passed over internal at Hopkins. I was trying to leave the floor and then go to a more educator role and all of that. One of the people who said, "Oh, you're suited for it. You're suited for it." Blah blah blah. I found out that they didn't promote me because of what she said. So it was a false whatever. Yeah. So so they said they were going to endorse me, but they didn't, right? Tough because it brought a lot of trust issues for me and all of that. I think the biggest thing is to understand why. if you are passed over for internal promotion, I would want, because there might be some things that you thought you were projecting and you are fit for, that you may be lacking, that you might need to build so that you are considered again. Yeah. So is there something that you are lacking that somebody else had a competitive advantage around it, and that's why they got the promotion? So, you know, so I would like to think people are fair, and these are the things that we're looking at. So what was their competitive advantage versus where you are, so that you can see that as an opportunity to learn and grow and build your portfolio, right? Boss who's insecure. You know, one of the things that we need to do is cultivate better relationships with our superiors and so on, to get their buy-in and pull them along the way so that they are not blindsided. Because sometimes I feel that, you know, you may be here and they're here, there's things happening here, and then they find out later, and then they feel blindsided, and then they feel threatened. So what is the lines, open lines of communications that you're building with your superiors to make them feel comfortable and keep them in the know of what you're doing? Half the time people are resistant is because they don't know. They don't have the knowledge. So starting by cultivating more direct communication strategies with your superiors, keeping them up to speed and being transparent about what you're doing, and also reflecting on your goals so they know where you want to go. That usually, whatever's anxieties, when people are insecure, it's because they don't know. There's a knowledge deficit sometimes. And then, you know, our culture, like I said earlier, has been very, very top down, that people need to feel comfortable with the way things are going in the world. And it's information. Knowledge is power. And you get more buy-in with the more knowledge that you have, not with everybody, but I'm just giving you strategies. I mean, for me, that has worked well in terms of communication over communication.
Thank you, Faith.
Is there anyone else with a question? We can just quickly continue with the introductions. Blessed, is someone called Blessed? If you don't mind, just introduce yourself quickly. Okay, move on to the next person, Elizabeth.
Hi, I'm Blessed Panda. Sorry, I joined it late. I had some other meeting, but I'm here now. Thanks.
Okay. Pleasure, thank you for coming. Elizabeth. Flora.
Hi, I just asked a question just now. I'm a nurse. I've been practicing, I think, for the last 8 years. And yes, I love what I do. I'm enthusiastic about it. And I'm staying true to my roots, I would say. Thank you.
Thank you. Isri, Juliet, Katil, Mevin.
Student, Bachelor of Medicine and Bachelor of Surgery, 5th year in JQuat. Thank you for the meeting. It was really informative.
Thank you for attending. Mevin. Leila.
Hello, my name is Laila. I've just finished my Bachelor of Pharmacy studies, and I'm eager to begin or continue the development of my career. Thank you for this. It was very informative.
Congrats, Leila. Michelle.
Hi everyone, I'm Michelle. I'm a third year pharmacy student at the University of Nairobi. I think this talk has rejuvenated my energy to go out there and somehow, conquer the world, but in a tactful way. Yeah, as I should not be limited. in my thoughts of late have been limited. So I think this has been a rebooting button. Thank you so much for the session.
So glad your mindset has been engaged, expanded. There's also Stacy, Sylvia, Valerie.
Hi, my name is Sylvia. I am a pharmacist currently doing my internship somewhere in Chuka. Thank you so much for taking the time to do this. This was really interesting. I have learned quite a lot. Thank you for taking the time, and thank you for organizing this. This is really, really helpful for us. Thank you.
Hi, I'm Juliet Mazero. I just cleared my Bachelor of Pharmacy. I joined a little bit late, but I'm glad the little that I heard will help me. Thank you so much.
Okay. Glad you gained some insight.
Hello, I'm Lilian Modoni. I also completed my BPharm in December. Juliet and Laila are my classmates. So I'm also very passionate about patient safety and quality care. And I think what resonated for me the most is making sure that whatever we learn, we apply it in the local context, what works for Kenya. For example, the online courses on patient safety, as Faith has said, are the falls in hospitals, but in Kenya, the old are not even able to access the care in the first place. So I think that's what really resonated with me, and also seeing a lady that's out there making it, having a family, and just balancing everything. I think that was very really nice and encouraging. So thank you, organizers.
Okay. Thank you so much for attending. Okay, I think we will end the Q&A session there as well as the introduction. Maybe you can, Faith, you can give us one last piece of advice or just a parting shot as we finish up.
I think one of the things I'll just tell all the young people there is define your purpose. Because I've been in roles where I was standing in somebody's purpose. And when I stepped back, I realized I was actually overstepping into somebody's dream and role and not actualizing mine. So understand your purpose. And then in this world, resilience, being able to bounce back. You know, nothing is cotton candy, and not everything works out in the way that you want it to work. But have the ability to be steadfast and resilient, and when one door closes, figure out how the other door should open. Don't wait for it to open for you. Figure out how to open that other door, and keep on moving. You know, nothing is perfect, and when you're trying to drive a really lucrative career, there's bumps. You go up, you go down. When you go down, you make sure you come back up. But you only do that when you understand the purpose and what your true end goal is. And for me, you should have a vision board saying, I'm here, but at the end of the day, I want to be Tedros. Okay, so how am I getting there? It means I have to go this way, that way. So actually define what your end goal is, and then start building a plan to be able to get there.
I'd really like to thank you so much for taking the time to come talk to us, ladies, and some few gents here and there. I'm really glad from the reception I've gotten from the participants today. I am super glad that you guys are benefiting from this whole session. That was the whole point of this Ryculture ladies talk, is to inspire you, the future women leaders in healthcare. And yeah, it's not all about books. There's also the outside of books that you need to develop to grow in. So I'd like to really thank our partners, KEFSA, as well as Planet Wizard, and the host, Ryculture. Thank you so much for bringing such an amazing platform, for bringing our guest here. And thank you also as well to our audience. Thank you for your participation, your questions. and also for sticking through. So the Ryculture Ladies Talk is a talk that happens every 2 weeks on Thursdays from 7 p.m. to 8 p.m. All details will always be posted on the Ryculture pages. So also as well be on the lookout for that information next week as well. So thank you guys. You may feel free to leave the session at your own pleasure. Thank you and enjoy your night.
Thank you.
I haven't given me an opportunity to say hi. I haven't said hi.
Oh, Soji, Arthur, go ahead.
Hi, how are you doing?
Fine, thank you. How are you?
I'm very sorry I joined in very late. I was invited by my friend Odhiambo. I joined in very late, and I'm very sorry I never caught the whole part of the conversation. But I think everything has gone on very well. I'm glad. Yeah, so next time I'm gonna try to jump in a little bit earlier on time. I'll be on time next time.
Okay.
Thank you so much for coming in, Arthur. However, the recording is available. I'll share it in some of our platforms so you can access it.
Yeah.
Thank you.
Thank you.
Thank you.
All right. Thank you so much.
All right. Bye-bye.